Well, as we continue to experience the winter weather, the frigid temperatures can strain the heart, leading to greater risk of having a heart attack. Here with me to talk about is UPMC cardiologist Dr. Maureen Qureshi. Doctor, thank you so much for joining us. I want to begin here. Break it down for us. How does cold weather specifically affect heart health?
Thank you for having me. So cold weather does affect the heart quite a bit. So cold weather leads to constriction of the arteries or narrowing of the arteries, especially in the skin to preserve heat for the body. But this in turn causes the blood pressure to go up. So the heart has to actually work extra hard to pump the blood into the body, which puts strain on it. The heart rate also becomes elevated, and if there's a blocked artery, that artery is not able to keep up with the demands of providing enough oxygen to the heart muscle, which can cause symptoms such as tightness or pressure or angina. Usually, if the symptom lasts for like 10 to 15 minutes, it's more angina. But if it's longer than that, about 30 minutes, that means a heart attack could be getting triggered because of the cold weather.
Well, that's interesting. I think a lot of people don't think about that, so that's a good tidbit. You know, what are the risks also associated with increased alcohol consumption during the cold weather season?
That's a great question, because we do know that alcohol consumption does go up significantly in the cold winter months. It gets dark early as well, so more people are consuming alcohol. And usually alcohol leads to more of dilatation of the arteries in the skin and in the periphery of the body to produce more warmth, so you get a feeling of warmth, but it's not actually really that the body temperature is going up. The core is colder, and that's why it's like a false sense of assurance that you're feeling warm. But actually it's detrimental to your health because the body temperature inside is lower. And this in turn can lead to hypothermia and other problems. Alcohol also can cause impaired judgment. So if you're out and about shoveling, higher chance of injuries on the ice. You may slip, the judgment is impaired. Some people tend to drive under the influence also, so leads to increased accidents. There's bad weather, the roads are bad. So certainly consumption of alcohol during the winter months, you have to be even extra careful how much you're taking in and really dress warm, because of this impaired sense of judgment, you may feel that you're warm, but you're not actually warm, so you may not put proper clothes on, which may actually precipitate hypothermia.
Yeah, speaking of warm, we always hear a lot about layering up during this time of the year to not get a cold, but why is warm clothing so important for heart health, especially in extreme cold? Could you talk a little bit more about that? I know you already touched on it a bit.
Yes. So warm clothing, especially dressing up in layers, wearing the winter coat, putting jackets that are water repellent and clothing that protects you from the cold wind is extremely important, because if you're not putting these warm clothes on, the body is going to have more constriction or narrowing of the arteries, which raises the blood pressure, again, increases your risk for heart attacks and strokes. But as you put these warm clothes on, there's the layering effect. There are pockets of warm air that are inside and provides better insulation, so keeps you more protected, less of a chance of heart-related issues or problems with that.
Well, on our screen here, we've been seeing people shoveling and snow blowing. Those are normal activities during this time of the year, and you mentioned that also as well. So what precautions should people take when engaging in those physical activities to pick up some of that winter weather snow that we may see?
Excellent question. So again, for cardiac patients, it's extremely important to know that shoveling can be dangerous, especially if they experience any symptoms. So you must listen to your body. So if you go out to shovel, if there's any tightness or pressure in the chest, you must stop right away. You should try some stretching before just going out and shoveling right away. Make sure you wear slip-resistant shoes, because ice injuries are a big cause of falls and fractures, especially in our older patients. And use the snow blower if possible. Make sure you're using scarves, you're using gloves, putting warm socks on, and using winter coats, jackets, and all that, so you're protected and you're not dealing with this constriction of the arteries and then increased blood pressure and more strain on the heart, along with the stress that you're putting with exertion.
Dr. Qureshi, all good information to keep in mind during this time of the year. Thank you so much for joining us. We greatly appreciate it.
Thank you for having me.